We are 1 month away from schools reopening, but many families, myself included, I'm sure Al as well, are still unsure about whether to send our children back into the classroom. So our medical expert, Dr. Kohli, joins us live. All right, Dr. Kohli, last week you said there's not a one-size-fits-all answer to this problem, but now we want your take on a new study. So in Germany, their summer school session just ended. They found that out of 2,000 students, only 12 tested for COVID-19 antibodies. So, Dr. Kohli, does this mean that children are less likely to catch and spread the virus like adults?
So in general, Sam, scientific studies and many scientific studies have actually shown us that children, especially the younger children, are less likely not only to contract the virus, but also to spread it to adults. But from this particular study, my main takeaway was that what happens in schools is really a reflection of what's going on in the community. And in this study in Saxony, the part of Germany where they looked at, the rate of infection was very low in the community. And I think that's the reason we saw a low rate of infection in the schools.
All right, Doc, first of all, how are you?
I'm great, Al. How are you doing?
I just need a second before I read this because this just hurts my heart to read this. Some school districts are not requiring masks for their students. Does this put teachers and their staff at a greater risk? I taught for 5 years. I taught middle school science, so this really hits home for me.
Yes. Absolutely, yes. And you know, teachers and school staff are such an important part of our community that this really upsets me too, because I think we really all need to be doing our best to try to protect them. And it's really disappointing that this mask debate has made its way into the schools. And that's what I'm most upset about, is that we know that masks work to minimize the risk of infection. And we know that other face coverings like face shields are also good alternatives to masks. So why this is up for debate, I'm just not sure.
So Dr. Kohli, I'm going to be selfish here. I have like another minute and a half with you. So Sophie, my daughter, this is her first time entering school, right? So she's so excited. She's got the backpack. She plays school every day. She's supposed to start in a month. Now, because it's a preschool and not a more populated middle school or high school, and I know you said there's no like one-size-fits-all approach, but do I send her to school? I want to. What do I do, Dr. Kohli? Tell me.
Great question, Sam, and I think you're asking the question that's on every parent's mind. So the first thing to ask yourself when you're deciding as a parent, what is the disease activity doing at this time? So here in Colorado today, our disease activity is going up, but I'm really hopeful that we're going to change that trajectory in the next 4 to 6 weeks by getting all hands on deck. So 4 to 6 weeks later, if we're holding steady or going down, I think it is very reasonable to send Sophie to school. But of course, because she's so young, she may not be able to do a lot of the social distancing, wear the masks and tolerate it. So a face shield might be a good option for younger kids, because then they can still see their teacher's face, they can still see each other's face. And guess what? They're a lot less likely to touch their eyes, their nose, or their mouth by adjusting the mask, because the face shield actually prevents that. So I think there are things we can do to get our kids back to school safely. The first and most important step is to crush that curve so that, what's happening in the community doesn't start happening in schools. And assuming we're at least able to flatten it or start to crush it, the next steps would be to do social distancing, space the desks apart, do a staggered schedule. So think about, a 7 to 1 schedule and then a 9 to 3 schedule for kids. And that makes contact tracing a lot easier too if there happens to be an outbreak in school. So it's not an all or nothing thing for sure. And I do think Sophie can get to school, and she should, because there's really a lot of benefits with in-person learning.
Thank you. I love the face shield. I'm going to put some stickers on the perimeter.
Can she
make
just
it fun
go on
and
national?
cool.
She's on national TV, but like for everyone at all times. So many parents have so many questions.
I know.
And just that's what a succinct, perfect answer. We appreciate you, Doc.
We so appreciate you. In fact, you will be back tomorrow, so get ready. DBL Nation, if you have a question about coronavirus you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com. Again,
they can email me. I have answers. No.
Email Dr. Kohli.
Okay. All right. Fine.
No panic, just prevention and precautions. We thank you, Doc.